Do you have a bulging or herniated disc and are unsure how to exercise safely? Should you try to stretch it out and push through the pain? Wondering what exercises you should do to speed up recovery or prevent recurrence of that terrible pain you had with a herniated disc? If so, then pay attention. We're going to cover the most effective approach in physical therapy and exercise science to answer these exact questions. Hi, I'm Dr. Charlie Oliver, a chiropractor and physical therapist based in San Antonio, Texas, with over 25 years of experience in physical therapy and 15 years in chiropractic care. My tagline for practice is combining the best of both worlds, and that's exactly what this channel is about, giving you expert advice from two professions so that you can live a pain-free life. I've seen it firsthand how combining these approaches can provide relief from back issues. Today, we're going to cover the most effective exercises for managing bulging or herniated disc, recap some crucial points from past videos, and ensure you avoid common pitfalls that can set you back and, worse yet, re-injure a disc problem. And disc problems normally get worse over time, so it is crucial we don't let that happen. So let's start with a quick anatomy lesson. Your spinal discs act like shock absorbers between your vertebrae. They have a soft inner core and a tough outer ring. When the inner core pushes through the outer ring, it's called a herniation. This can press on nerves and cause pain. The key to managing a herniated disc is to avoid activities that push that inner core backwards, which often happens when you bend forward or even sit for long periods. Before we jump into the exercises, remember this: only do these exercises if you've been diagnosed with a herniated or bulged disc by a healthcare professional. The goal is to perform exercises that relieve pain without making it worse. Starting out, if you're in the acute phase of pain, lying on your stomach can be a great first step. This position creates a gentle backward bend of the spine, which helps push the inner part of that disc forward and off the nerves. If your disc herniation is really big and you've got a lot of inflammation and it even hurts to lie on your stomach, you can even place a pillow under your abdomen so the spine is kept in more of a neutral position. Now, over the course of a day or two, this should become easier and easier, and then you can remove the pillow. Then, as you're lying down, as I mentioned, you're going to be able to have an arch in your spine, and then from there, you can even move to being propped up on your elbows. After you can do the lying propped up on your elbows, try the prone press up. So imagine you're lying on your stomach, your whole body flat on the floor, and you're going to push your upper body backwards so that everything from the waist on up comes off the table or the floor, and everything from the waist down stays on the floor. So essentially, it's like a cobra position or cobra stretch in yoga. Now, when that should be pain-free. Absolutely, it should not cause extra pain, especially on your side or down the leg. But this is a staple to a specific method in physical therapy called the McKenzie method, and that is something you want to do throughout the day. Now, you can also do a version of this exercise standing up, because obviously you can't be lying down on the floor out in public or at work. So the standing version of that is you place your hands there at your waist and you bend backwards. And again, same principles. We do not want to make leg pain or numbness any worse. You should feel a stretch in the midline of your spine, and that's absolutely okay. So keep in mind, each of these exercises can give you some discomfort along the midline of your spine, and that's absolutely normal. We are stretching ligaments, and you're putting your spine in a position it's not normally in. So it's okay to have some discomfort. To recap, you should not have increased pain or tingling down the leg. And also, like I said at the start of this video, you do want to be diagnosed with a herniated disc before you go about doing these exercises, because there are several different conditions which could be made worse with that backward bending, especially repetitively. As far as tips for daily life, the biggest thing for you to understand is that sitting is tough on your back. So to mitigate this damage, try to keep your hips higher than your knees, whether by adjusting your chair height or using a lumbar roll or even a rolled up towel to maintain that arch. This helps keep the natural curve in your spine, and actually when your knees are lower than your hips, it naturally rolls your pelvis forward, and so then you don't have to think about it, because no one can really spend their entire day trying to sit up straight. So aside from that, remember, standing is better than sitting, which I love how people are nowadays using those sit to stand computer desks. You do want to spend more of your time standing versus sitting. The other big killers for folks is when you get home from work, what do? If you're like me, you plop down on the sofa, you're watching TV, you're on your phone, you're on your computer. Again, being on a sofa or a deep chair or sitting in the recliner, you lose that arch. So that is just a really great way to undo all the hard work your therapist or your chiropractor or you've been doing to try to keep that arch in your spine all day long. What I would suggest you do is, instead of sitting while you're watching TV, lie down on your side. Or again, most of us, we're on our computer or our phones at home. Lie on your stomach, and again, when you're on your stomach on the floor or your sofa, you're actually in a version of extension, right? You're kind of propped up on your elbows. So now you've got an increased arch. By understanding your condition and following these exercises and tips, you can work towards alleviating pain and preventing future problems. It's about maintaining the natural curve in your spine and avoiding those activities that make your condition worse. If you found this video helpful, please like it and subscribe to our channel for more valuable content. And if there's other topics you want me to cover to address specific conditions you have, drop me a line in the comments below. And as always, we're here to help you live a pain-free life. So have a wonderful day and see you in the next video.